So good morning, everyone, and good morning for those who are here in person as well as for those who are online today. My name is Jean-Michel Gon. I'm the CEO of for Action Against Hunger, and it's really my pleasure to welcome you here to celebrate the release of the WHO guidelines on the prevention and management of wasting and nutritional oedema for children under 5 years old. At Action Against Hunger, we have been actively involved in the development of these guidelines through the whole process, and like many of you in the room, being very looking forward to their release. So looking forward to hear more about it. Obviously, for Action Against Hunger, the treatment and prevention of malnutrition is very core to who we are and what we have been doing for the last 40 years. And in last year alone, we facilitated the access to the treatment of malnutrition to 785,000 children. So it's demonstrate how important and critical these guidelines are in the organization. However, sadly, there are many more of these children that we need to access and to deliver proper treatment. So we are very excited to see how much the new guidelines reflect our core approach in improving this equitable and sustainable access to the treatment through, and we will go in details, but the better integration between nutrition and health, which is absolutely critical. The more involvement of communities and especially community health workers. And thirdly, also, the need to continue to generate high quality evidence on the effectiveness and cost effectiveness of intervention. There has been a lot of focus on treatment over the last decade. Therefore, we are really welcoming the prevention part of the guidelines that highlight the needs to have a very contextual approach to prevention, and how this preventative approach are informed by the communities who are experiencing and living malnutrition on a daily basis. So we are very proud to organize this event, and we would like to thank very much Ben and company for welcoming us tonight. And Ben and company has been partnering and supporting Action Against Hunger and me personally over the last 15 years. So thanks a lot to Ben. But without further ado, I will now hand over to Francisco Branca, who is the director of the Department of Nutrition and Food Safety at WHO, and who will tell us more about the guidelines.
Well, thank you very much, Michel, and good morning to all. Also, good afternoon and good evening to those who are online. First of all, let me thank Jean-Michel and Action Against Hunger, but also FCDO and Chris Carter particularly for co-hosting this event with us. And let me thank my colleagues and friends, and as we like to say, brothers and sisters from UNICEF World Food Program and FAO. Sorry, Lynette, you cannot be here with us, but we are often together for working very closely together. And frankly, I think that the only way to do this, to respond to such a major challenge is to work together. I normally start by giving the magnitude of the challenge, but you're familiar with that. It's unfortunate that still 45 million children are affected. That's about 7%, way above what we've said we would achieve by the year 2025, which is less than 5%. Particularly, some parts of the world are affected. We know that 14 million children live in areas affected by conflict. And out of those 45 million children, then we know that at least a third are affected by the most severe form. This is leading to death and suffering. And we give the numbers, and the numbers say that about 1 million children die every year. It's an enormous, difficult to conceptualize. It's half a city dying every year for that. And also it's difficult to conceptualize just given the numbers. But many of you have been in the field. Many of you have realized the human suffering related to each one of those lives, and also the lifelong sentence that wasting and different forms of malnutrition carry, which is basically having a life sentence to health and poverty. So clearly this is a very good reason to urge us to scale up our work. And since 2019, there has been a major effort to work together in the UN context to develop a global action plan on child wasting, really to push for more comprehensive, particularly comprehensive action to prevent and manage child wasting. As Jean-Michel was saying, we've been focusing on the management, but now we're putting the emphasis on the prevention. And the Global Action Plan was saying, well, we may need some normative guidance to support governments in the prevention and management. So that's why we developed a guideline. Guideline processes in WHO have some rules, and we have to base our work on the systematic analysis of the evidence, but we also look at the context and the practical experience, and that's what happened. I really would like to acknowledge all the people who have helped us in this important effort. So what do these guidelines say? The guidelines were actually launched officially yesterday, and I really was pleased to see our Director General joining us to do that, and thanks to FCDO for having convened this important summit. So the main concept around prevention is that we're putting the focus on child health, and we're putting the focus on multi-sectoral approach for the prevention, sustained recovery of wasting in children. So it's basically a continuum of care approach which we need to have. We cannot treat a child and then child goes back in an environment where she or he is going to again develop malnutrition. Then we're focusing on the importance of the connection between the mother and the child. So they are an interdependent unit, and we need to identify those couples at risk and basically take care of both. So they both need to survive and thrive. Sensitive and effective care of infants and their mothers is one of the most effective preventive actions of all. The other aspect is we need to improve the diet at home, so promoting breastfeeding first and foremost, adequate home diets, but also we need to have good access to quality healthcare and to sustainable resilient interventions that will empower the communities to look after themselves. But we also, and you've seen this before, we also stress that on management there have been some development. There's a lot of good experience on which we could build. So on management, perhaps the main concept is that community health workers can play an important role in providing evidence-based care for children with acute malnutrition. So community health workers can manage children 6 to 59 months of age with acute malnutrition in the community, as long as they are adequately trained and receive ongoing supervision and support. So, there must be some context analysis to see whether that's actually feasible. We know that's an efficient way to act in some circumstances where emergency needs and scale of action is critical. But we need to put the emphasis on the good quality of care. Community health workers have a lot of pressure. They have a lot of things to do. They are often not paid. So if they are not adequately trained, they're not built in a system where the delivery of the intervention can be effective, then perhaps that needs to be adequately considered. The other important point is that the guidelines update the recommendation on therapeutic feeding. we're considering, of course, not just the severe acute malnutrition, but the moderate as a continuum. Acting on moderate will curb the shift towards the severe, but not all children with moderate acute malnutrition need specially formulated food to supplement their diet. So we need to understand what the risk factors are to prioritize which children with moderate acute malnutrition need to receive supplementary feeding. And some of these risk factors are the high-risk context, such as humanitarian crisis, but also specific individual or social factors. So fine to give this supplementary food, but those in need. And then the children with severe acute malnutrition, and here we also need to consider what we mean by that and diagnosis, and we have to consider the edematous malnutrition as well. They should receive nutritional treatment with a ready-to-use therapeutic food that meets Codex specification. Now we have Codex specification for that. We also have an essential medicine list that is included ready-to-use therapeutic foods among the elements that need to be considered, and of course, countries to adopt that essential medicine list. The amount of ready-to-use therapeutic food given can be either constant until anthropometric recovery, or reduced after achieving, the more mild stage of moderate acute malnutrition. But this depends also again on the capacity in the context. So again, we are really stressing on the importance of the context. And finally, the guidelines also mention infants less than 6 months of age at risk of poor growth and development, which we're not doing in the past. So these are the guidelines. What next? WHO is working closely with the other UN agencies supporting the Global Action Plan on Wasting to develop pragmatic operational guidelines that will help policy makers, program managers, and health workers implement the guideline and ensure that multi-sectoral approach. So health, water, sanitation and hygiene, agriculture, social protection. WHO is taking a child health and family-centered approach when supporting countries in the implementation of the guidelines and ensuring the inclusion of interventions on the prevention and treatment of wasting in essential health services. And I think that's the other important piece that happened. Again, thanks also to the support of FDCO, the inclusion of this as a component of the universal health coverage. It was mentioned several times in the UHC document in September. I think that's a good way forward. And I believe that we can have, as part of the UHC index, the coverage of the treatment of severe acute malnutrition as an important component. In addition, regional and country workshops are ongoing where the UN agencies implicated in the GAP come together with their government counterpart and other key national stakeholders to carefully develop national policies and protocols which incorporate global WHO recommendation, but are adapted in realistic to local context. So I really would like to finish by thanking all those who have been involved in producing the guideline and the donors who have supported its implementation. It's actually a big group, and it's been good to have those donors involved, also following, somehow pushing us a little bit also on making the guideline better and quicker. Eleanor Crook Foundation, Children's Investment Fund Foundation, FCDO, and UNICEF. And those who contributed to the development of the guideline, the methodologies, the guideline development group, and systematic review authors, and some of them are here. I cannot mention all of them, but again, thank you very much, and thank you for yourselves being giving contribution to the guidelines. I mean, that's what we need to do. It's based on the collective understanding and experience of the problem. That's a guarantee for our success. Thank you.
Thank you very much, Francisco. So now we are going to have four speakers, and we're going to discuss about the new opportunities offered by this new guidelines, as well as the way forward in terms of implementation. Starting with Victor Aguayo, the Director of Nutrition and Child Development at UNICEF. Victor.
Thank you very much, Jean-Michel. Francesco was giving us some figures about the extent of the problem, and I will give some figures, but I always like to start with the good news, because there is good news, and sometimes when talking about child wasting, we go so immediately into the challenge, the gap, that we forget to celebrate what we are achieving together. So let me share with you a couple of figures that I think will put things in perspective and again, acknowledge and celebrate what we are achieving together. So in the last 2 decades, if you think between the year 2000 and the year 2020, we have been able to reduce the prevalence of child undernutrition by 1/3 and the number of undernourished children by 55, actually 56 million. And that is despite population growth, that is despite the right investments, that is despite the right political decisions and the right political will. Last year alone, collectively, we were able to reach 350 million children and women with programs and services for the prevention of stunting and wasting in early childhood. So I'm signaling this because I deeply believe that there are reasons to believe that positive change for child nutrition not only can happen, but is happening at scale across countries, across regions in Africa, in Asia, and beyond. So that is on the positive front of our news. It is true that the global food and nutrition crisis could slow down the rate of progress, could also reverse the gains that we have made in the last couple of decades. Yet last year and yet again, and I want to continue with the positive news, we collectively were able to screen 182 million children for severe wasting in our priority countries, that is countries primarily affected by humanitarian crisis and severe food insecurity. So 182 million children screened, and we were able to provide treatment to 7.3 million children with severe wasting, which is a 35% increase when you compare this figure with the figure the previous year. And it is the largest number of children ever treated in 1 year since we are collecting data, which is pretty much in history. So many reasons to believe that what needs to be done can be done. It is true that the number of children with life-threatening wasting remains far too high, as Francesco was reminding us. And we need to be able to collectively do much more and much better. However, there are 4 developments in the last couple of years, 2022 and 2023, that make me confident about what we can achieve together. The first, and Francesco made a reference to that, is the inclusion of ready-to-use therapeutic foods in FAO's Codex and in WHO's Essential Medicine List. I also want to signal that it took 5 to 7 years of very serious advocacy to cross those milestones. So perhaps we need to do a little bit more in the future so that the right things don't take such a long time to happen, but let's celebrate that they did happen. In 2023, another milestone, and that is the reason why we are together here today, the guidelines for the prevention and management of child wasting by WHO, a major milestone. A third reason for hope, in my opinion, is the Action Review Panel and the Child Nutrition Fund, 2 global mechanisms to coordinate and respond to the challenge of child wasting. And finally, a renewed partnership between UNICEF and WFP to address child wasting in humanitarian settings. And I want to take Jean-Michel a couple of minutes to speak about that partnership, the partnership between UNICEF and WFP, because I know that many in the room will be interested. So UNICEF and WFP are going to respond to this challenge of preventing child wasting first and treating child wasting when prevention fails. And we're going to do it through a combined package for children and women in highly food insecure settings. UNICEF is going to lead on treatment, the treatment of children with severe wasting, and the treatment of children with moderate wasting who are at high risk of death. And we estimate that this is going to increase the number of children that we will need to treat with ready-to-use therapeutic foods by 15 to 20%, depending on settings. However, where treatment is needed, prevention is even more needed. And UNICEF and WFP are going to step up our efforts to prevent that children become wasted in the first place. And I'm sure that Abby is going to say more about this. How are we going to do this? So we're going to be supporting a set of complementary actions to prevent child wasting. UNICEF will do what UNICEF does best, which is support access to essential nutrition services and essential nutrition practices for children and women through facility and community-based interventions. And WFP will do what WFP does best, which is provide a range of food-based interventions to supplement children with moderate forms of wasting, in addition to food assistance and food support to the most vulnerable families, children, and women. We are going to manage this transition in 15 priority countries. These are primarily the countries in the Central Sahel, the countries in the Horn of Africa, and some other countries going through significant crisis. This transition will happen over the next 3 years, and we are quite confident that we're going to get to the finish line successfully. Year one, we will make a couple of mistakes, and we will learn from our couple of mistakes, and then in year two, we will make only one mistake, and in year three, there will be 0 mistake. But I'm very confident that this renewed partnership is going to translate into a success story. We have a common vision that we both share, Abby and I, WFP and UNICEF, is that prevention must come first. And to me, if there is one key message in the guidelines that we are presenting and celebrating today, is that child wasting can and must be prevented. The fact of the matter is that most children in the world never experience child wasting. It is only 5, 6, 7% of children who do experience child wasting. So preventing wasting must come first. And of course, when prevention fails, quality treatment is a must as early as possible. So I do want to acknowledge our partnership with WHO and with WFP, my partnership with Francesco and with Abby. Thank you, Francesco. Thank you, Abby. And I do want to acknowledge Jean-Michel, ACF, and FCDO for hosting us today. Thank you for having us in this event, and over to you.
Thank you very much, Victor. And as you mentioned the partnership with WFP, let me introduce Abigail Perry, the Director of Nutrition at the World Food Programme. Abby.
Thanks so much, Jean-Michel. It's really a delight to be here today to hear the outcome of, it's such an extraordinary amount of work by WHO, entire team, and many of the nutrition community to develop these guidelines. Again, I know there's many friendly faces in the audience who've been waiting with bated breath for WHO guidelines on this topic, and it's an incredibly important moment for us as a community. As Victor has noted, one of the kind of key opportunities that have come from this guideline is to really, for ourselves and UNICEF, to invigorate our discussions and our work together about how we can collectively and effectively deal with this challenge of acute malnutrition. And I do want to note that as we've been moving forward in the context of looking at operationalizing these guidelines in these 15 priority countries, that USAID has been a really important ally for us and really strong supporter as we've gone through this constructive process over the last few months. Now, for WFP, the key focus for us as we look at the implications of these guidelines is what this means in areas of acute food insecurity. That's clearly the area of focus that WFP has in particular. And I think it's worth noting that I do want some optimism in the world about what's happened over the last years with the nutrition story. But the tough reality is that we're still dealing with extraordinarily high levels of acute malnutrition in these areas of acute food insecurity. And as colleagues have noted, the crises and challenges that we face over the last couple of years are making it even harder to try and bring that challenge under control. Last year, WFP ended up delivering direct nutrition support to 29 million pregnant breastfeeding women and girls and children under the age of 5. So both providing prevention services as well as support supplementation for moderate wasting. And for 2023, the number that we're aiming to reach has not gone down. So we're really still dealing with an extraordinary high level of vulnerability combined with this challenge of acute food insecurity and conflict. So for us, one of the key opportunities coming from these guidelines, first, the opportunity to really look at how we can harness our collective strength as UNICEF and WFP to deal with this challenge more effectively, but also for us to really start testing out with the support of our donors, with many of you who I know will be very intimately involved as we take this forward, to really try and test ourselves in finding more effective solutions. So there's a couple of key shifts that I want to highlight that we're particularly focusing on as we're looking at this rollout of our operationalization of the guidelines in the 15 countries. So as Victor noted, we're giving a much stronger emphasis to prevention. And that will involve us harnessing our general food assistance, so an enormous footprint that WFP has, unfortunately, on an annual basis. But harnessing that general food assistance alongside targeted support for pregnant breastfeeding women and girls, and for children under the age of 5, as a mechanism to try and stop as many children requiring supplementation or indeed going on to require treatment. Now, we're underpinning the design of our approaches more and more with stronger analytics to understand how we can provide general food assistance and targeted support in a way that addresses the nutritional requirements of those groups, but looks at more efficient and sustainable ways of doing that. So we know that there are different ways that we can deploy cash-based transfers along with different types of specially formulated foods in these contexts. But also we're looking at how we can better enable people to access more healthy, nutritious diets from local markets. So for example, we've been working to strengthen the way we use our cost of diet tool, which was supported heavily by Save the Children, but also to look at strengthening market functionality assessments so we can really properly understand where we can enable people not to rely on specially formulated foods as part of a prevention package. I think it's worth noting that this is not a straightforward exercise. We know in many contexts it's still going to be extremely important to use specially formulated foods as part of a prevention package for young children. But we know that this is offering us an opportunity to look slightly differently at how we can both respond now, but inform, for example, national social assistance programs in the long run that can more sustainably address these challenges and hopefully stimulate better food systems for these very vulnerable populations. The second shift is in how we're approaching this, the supplementation of moderate wasting. So we'll still have quite a large caseload to support when it comes to supplementation and moderate wasting. And again, we're increasingly using our data and analytics to better understand how we can support those groups, again, without an over-reliance on specially formulated foods. What we are finding in the countries where we're starting to take forward this collaboration with UNICEF is that it's already not that easy to do that in these areas of acute food insecurity. It costs 6 times more to address the nutritional requirements of a child with moderate wasting than it does to deal with the equivalent child who isn't wasted because of their additional nutritional needs. So we're having to look quite carefully at how we can deploy, again, cash top-ups, testing out the use of more fresh food vouchers, thinking about how we can use smaller quantity nutrition commodities to really look at how we can get efficiency and value for money in the way that we're supporting these populations without compromising on the impact on their health outcomes. Now, we're also aiming to underpin this with a much greater focus on operational research, again, working in close collaboration with UNICEF. Again, the tough reality for these contexts is that we still don't have as much evidence as we need about what works. So this is going to be an increasing focus. And again, we're looking forward to collaborating with actors on the ground, as well as our donors, to make sure that we can generate evidence of what works to help strengthen the way that we're able to deploy our resources as effectively as possible. So this is a really important opportunity for us, I think, as a community to deal with this issue effectively. I'm really looking forward to seeing how this goes. As Victor said, I know that there'll be some missteps along the way, but this is such an important chance for us to do a much better job in how we support these very vulnerable women and children. And the one kind of call I would have for everybody is that we know that these contexts are incredibly difficult. We know it's hard to generate evidence in those settings. I think this is such an important opportunity that I would really just welcome the support from everyone to look at how we can harness humanitarian financing, resilience financing, and our collective energy, creativity, and innovation so that we can really say in 5 years from now that we have much better solutions and we can really tackle this problem building out of what WHO has set the path for us today. So thank you.
Thank you very much, Abby. Our next speaker is Lynette Neufeld. She's the director of the Food and Nutrition Division at FAO, and Lynette is online. Lynette, the floor is yours.
Thank you, and apologies that I can't be there with you today to celebrate all of the release of this document and all of the progress that you have all been highlighting. And congratulations on the partnerships that you're also announcing, which I think is critically important. But I want to take a step even further down the prevention pathway. We know that malnutrition in early life affects child growth and development. And it therefore jeopardizes the livelihoods and the well-being of families and communities, and ultimately the development of nations, that we cannot recover if we don't address it from the outset. So you've heard about that, about the opportunities to prevent. And I would like to take a step back and remember also that the acute malnutrition, the causes of acute malnutrition, are deeply rooted in poverty, in inequalities, and the resulting acute food insecurity that entails for households and for communities. We've heard from others the importance of life-saving interventions to address both moderate and acute malnutrition, and they're critical. But if we don't start to break this cycle, and we don't build in complementary actions that directly address these issues of poverty and inequalities, that limit change, and the many conflict and climate-related crises that are threatening the children, we won't be able to speak about lasting progress. Every child deserves to have that opportunity to survive and thrive without even starting down the pathway of acute malnutrition. And we can only do that if we build resilience in communities and households. So I think, as you all know, those who are at most risk for acute food insecurity, many live in rural areas, estimated approximately 2/3 of those who are at risk of severe acute food insecurity and the resulting child malnutrition. So working with those communities to build and bridge this gap between the actions that are happening in humanitarian assistance and the more development, prevention, resilience building actions is fundamental. So the UN Global Action Plan for Child Wasting already has articulated the importance of that continuity and that resilience building. The approach at FAO that is a part of that aims to develop and scale solutions that address those root causes, improving livelihoods, improving resilience, addressing inequalities, whether that be co-located with some of the actions that you've heard about that are more specific to the children and the women who are most at risk, or by building out those and embedding some of those actions where the opportunities exist. So obviously, food and nutrition education is a component that must be addressed. Food safety, food storage, food handling, processing, etc., are all a part of these actions, and obviously with a very important focus on gender empowerment, social inclusion for women and for rural adolescent girls. We've already heard the importance of the gaps in the evidence, and particularly there are gaps in evidence related to agriculture interventions and their potential for this treatment, or for this prevention of acute malnutrition. There's no doubt that there are gaps in that evidence, but that's no excuse for inactions. We know what breast and complementary feeding practices that favor child growth and development are. We have guidance for those. That's what every child in the world needs to consume and needs to be brought into early life. And there is no excuse for us not to be building those into the work that we are doing in communities and with households as a part of these agriculture and resilience building activities. And that is where we can truly build out this idea of a true continuum of care for children. So we also are hoping to continue close collaboration with our UN counterparts and the countries where we work and the other organizations where we work. We can't achieve this without all of the partners working together, all aligned with our mandates across of our individual focus that has been provided to us by organizations and our donors. FAO is committed to doing our part, linking to our work on food production, on environment, seasonality, social protection, livelihood systems. Recently, in collaboration with Tufts University, for example, we have published a new journal supplement that brought together the potential of some of these actions to address the underlying drivers of acute malnutrition across Africa's dryland region. So I look forward to joining the efforts of all of you to drive that change, to generate the evidence that we need to ensure that the food that children and households need to survive and to thrive is available, it's affordable, it's accessible, and it's consumed in the way that we know needs to be consumed to truly prevent malnutrition from ever starting and gaining a foothold in households. Wouldn't it be incredible if the next time we meet, we talk about the number of cases, whether we need to estimate it, however we are able to estimate it, but the number of cases that we've prevented and the lack of the need for treatment, that's where we need to get. And that's what I hope to hear the next time we're talking, with all of the evidence that and the partnerships and the resources that are brought to the table today. Thanks.
And before we go to the question and answers, last speaker is Danielle Witten-Smith. She's the managing director for the Bureau for Humanitarian Assistance and USAID. Danielle.
Thank you. And first, my apologies for walking in late. I greatly underestimated London traffic in the morning and how long it takes to get from one side of town to the other. So my apologies. I think most of my colleagues have highlighted a lot of the work that is being laid out in the new guidelines. So I just want to share USAID's viewpoint on the new guidelines, which we really see as an opportunity to approach wasting programming differently. We see it as removing barriers to accessing care and bringing treatment to the home, really carving out a space for community health workers and empowering local health systems. And we really appreciate the focus on maternal nutrition and family foods. I've spent most of my career focused on food security at the household level, especially in emergency situations. And so seeing the focus on family food security as a prerequisite for wasting prevention is really something that we at BHA and USAID value. We're really energized to operationalize the implementation of the guidelines. As Victor and Abby were saying, we've been working closely with UNICEF and WFP over the past year on the rollout and implementation in humanitarian settings where we work. And we really do see kind of this as an opportunity to prioritize our funding and our support in some critical countries and see how this works over the next 3 years to phase in implementation. So we really appreciate the partnership and look forward to continuing our work together. I also wanted to just maybe call out the role of therapeutic foods. This is something that we support quite a bit at USAID. And we're always looking for new and innovative ways of working in relation to the production and delivery of the commodities. Funding requirements for nutrition activities has increased as well by 40% over the past 2 years. So to really stabilize costs, we are also looking for ways to boost the global supply chains for therapeutic foods, as well as looking at how we can better multi-year plan with countries and encourage domestic funding to production, procurement, and delivery of specialized food products as well. We're also committed to continuing research and support on alternative forms of RUTF in hopes that we might be able to potentially reduce the costs in the long run and bring down and make it more accessible to more people. And I maybe would say finally, as a donor agency, we encourage ourselves as well as others to really think through how we can identify and prioritize ways we can adapt to better support systems and implementation. Not only in humanitarian settings, but also how we can create sustainable funding for nutrition within health systems. And we really do stand ready to support our partners as we put these recommendations into practice. So thank you again for the opportunity to be here this morning.
Thank you very much, Danielle. So we now move to a short session of question and answers from both the room, but also from the over 500 participants online. So I'm going to ask Rachel and Bernadette to take the question and facilitate the session. Mm-hmm. So please, if you time is tight, so if you can be quite concise in your question more than making a long statement, that would be very appreciated.
And please state your name and your organisation and who you're addressing your question to when you're asked. Yes.
I'm Julie Keith with the University of Westminster. Some people who know me in the room, Save the Children and others, of the last 40 years. So it's great to see, first of all, that a room full of people on severe acute malnutrition, because some of us have been pushing for attention on this for decades, as everyone will know. So my two questions, first of all, to WHO. So it's great to see these guidelines, but we do need, there's still a lot of work that we still need on, for example, kwashiorkor versus, how we're going to reach the oedema issues that are with and without that. We're still having huge issues about identification and treatment. We know only 20% of, even in Ghana, 20% of children are getting identified and getting wonderful RUTF. So it's wonderful to hear that USAID are going to support other kind of RUTF, but again, we're seeing a lack of that at the poorest areas. And the second thing is, again, it's really great to hear about World Food Program, about looking at cost of diet tools, et cetera, working in collaboration. But we have seen a real time, and again, so the Foreign Office is kind of another one in that one, but a real time reduction in the amount of funding that has reached the rural areas, places of Ethiopia. I can call it 12 countries in Africa as well, where the programs have just stopped. There hasn't been RUTF for at least 6 months in some of the places, not even the MWAC tapes. So I guess for me, it's great to see the guidelines, but I think the action is really on the ground in the hardest to reach areas is what I want. Less meetings, more action, and how is that practical going to happen? And again, the foreign summit that we just had, it was great, but not everybody who's on the ground is there. It's wonderful to see everybody in the room, but again, the action thing would be really great to hear about a little bit more details on that and the resources for the research. And that would be really great. Sorry.
Thank you. Let's take one more question.
Yes, one more question. Yes.
Hello, I'm Alexandra Newland, the head of the Sun Civil Society Network. We commend, of course, UK and FCDO's leadership yesterday and the new guidelines by WHO and the efforts and commitments made to ending wasting. My question is, as I represent a network of 5,000 member organizations, civil society organizations working on the ground to reach the most vulnerable and the most affected, how do you expect these guidelines to be translated at the local level? And how will civil society be equipped to really translate these guidelines, equip community health workers, equip civil society organizations in making them tangible for those most, the hardest to reach? Thank you.
Thank you. And last question, Terry. And then we move to the response first, and then we go to online.
Well, thank you very much. I'll be brief. I would really welcome the views of the panel on some of the challenges that the new guidelines might pose to governments in high burden countries, and how we might support those governments to meet the challenges. Thank you.
So, Francisco, the first question on kwashiorkor and oedema.
Yeah, I take it as, in a sense, as a general question on research. So first of all, let me tell you that these guidelines are not closed. We have now changed the system in WHO. There are always living guidelines. So we don't have to wait 10 or 20 years to have a new version. So we are continually looking at the new data and the new research. We're not necessarily always generating new research. We're actually generating the request for research, the questions. For this purpose, we have created jointly with UNICEF a technical advisory group that is going to look at those research questions, prioritize those research questions, and somehow help setting up the necessary studies. And we do have a number. I mean, you mentioned definitely the kwashiorkor, the edematous malnutrition one. So there is an issue around the diagnosis, but there is also an issue around the pathophysiological mechanism. And you appreciate that, for example, these guidelines have said much more around around fluids, for example, and electrolytes. That as a result of research. But there's more to do in terms of understanding the response and the formulation of ready-to-use therapeutic food has been the source of considerable research and controversies. And we need to continue on that research and controversy, and as well as the operational models you've heard. I think the business model that with UNICEF and WFP agreement is going to start. We need to see and how it can be optimized. The whole discussion about what are called the simplified protocols needs to continue to generate that science. In some cases, we have already found some result. In some cases, we should continue.
Thank you. Abby, you want to take the question on the action in order to reach the hard to reach areas?
So this is a significant part of what we're, again, both UNICEF and ourselves, but for WFP particularly, really looking at this question about how we can maximise the ability to ensure that these services do benefit hard to reach populations. Again, I think there's room for kind of innovation in how we look at service delivery. For us, also looking at how we can piggyback on the way that we provide general food assistance in context so that we are able to benefit from the enormous logistical capability and financial infrastructure that WFP has supported in many countries. But the point that I want to highlight on this is the tough reality of the financing environment. And you know, we benefit from enormously generous donors. So I do have to note that we do have very, very strong donors. But ultimately, we are very reliant on humanitarian funding. There is an extraordinary degree of unpredictability around that. So I think we all also, the reason for me highlighting the funding situation is that as much as we're tightly prioritizing, we're finding better ways to reach those populations, we have a big deficit in the availability of funding. So we're going to have to get creative about how we enable financing that is more predictable for these contexts, because predictability enables us to operate in a much more efficient manner. We can plan our pipelines better. We've done everything we can internally to maximize the way that we do that as WFP, but the financing will have to be more predictable. That we also test out these more efficient ways of operating. We need that kind of research investment to help us test those different ways. But we also need to really expand the financing that can go into these kind of grey areas between your development settings and your acute emergencies, where we know there's that fragility, where we know we've got these unpredictability and needs. We need more flexibility. So, I mean, this is not a new thing to be asking for, but I'm going to highlight it again because having moved from being on the donor side back into an operational agency, it's been really stark to me just how much that financing landscape does make it very, very difficult to do exactly what we all should be doing to make sure that we can actually reach these very difficult these very most affected populations.
Thank you, Abby. And we spoke about the importance about the community health workers. So Victor or Francisco, would you like to respond to this question about how do we translate these guidelines at very local community level? And
I'll be happy to say a few words about that, but I would like to say also a word about the first question was making a reference to finally greater attention to child wasting. And we need to also ask ourselves why that is. And I think that is also to a significant extent, because for far too long a time, a few decades, we, international organizations, have operated in ways that made child wasting our business and not the business of national governments. So I think we also need to acknowledge that child wasting far too many times has been presented as the form of child malnutrition that donors, partners, UNICEF, WFP, and WHO will take care of, and governments should not worry about. That is not completely true, but there is some truth to that. And that is something that we are trying to change. Most children with severe wasting, most children with wasting do not live in humanitarian settings. They do not live in Africa, and they live in countries where their governments and ministries of health need to do a much better job in identifying those children so that they do not become wasted, and if they do become wasted, provide them with the treatment care that they need. So I think that is important, because for too long a time, we've thought of wasting as what we do. Governments do not worry about that. Then comes what I think is a breakthrough with the new guidelines, which is community-based workers not only can identify children in need of treatment, community-based workers can treat children in need of treatment. And that is going to require that we train, supervise, recognize, and pay an army of community-based men and women who can do exactly that job as part of an extended primary healthcare system. I think CSOs, civil society organizations, and I'm thinking primarily national and local civil society organizations have a major role to play in precisely that. building that capacity at the community level. International NGOs can support that work and should be supporting that.
Can I add one word on the CSOs, because I think this is critical. We definitely need the collaboration of the CSOs exactly to do that. We need to do the adaptation, the context. I use the word adaptation many times. I mean, situations are different. We need to have that adaptation, so we need to have that, feet on the ground. But please, 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 this should be done in agreement with UN organization and the governments. Otherwise, we're going to lose all this momentum of harmonization and collective impact.
And finally, the challenges that Terry mentioned about that you anticipate that government in high burden countries might face. Who wants to?
I'm happy to start.
Yeah. Just a few minutes.
Yeah, very briefly.
Please.
Thanks. I think there's a couple of key things that are kind of keeping me awake at night on behalf of governments. For the prevention story in particular, I think this question about what works, so what are we advising them to invest in, is going to be a really critical thing for us to kind of get right, because without the ability to invest properly in testing out that, I have a concern that our ability to kind of enable governments to take leadership to kind of get this challenge under control, as I said, through areas like kind of stronger nutrition focused social assistance, through the way they think about their food systems investments, then we're going to end up kind of continually in this cycle. So this is where I think we are going to need to double down. The second area I want to highlight that doesn't get given enough focus, I think, in these discussions, for high burden countries with this unpredictability, a big challenge is going to be to ensure they have the data systems to be able to understand what's happening. I think there's an enormous opportunity for us to get more efficient in scaling up our support through more systematically, but we need better data systems to really properly understand where risk of wasting is happening. We have a collaboration with UNICEF, supported by BHA, to strengthen that mechanism and that way of looking at this, but it's got to be something that we're supporting governments on, because across East West Africa and a number of other contexts, better data will enable us to target, prioritize, and ensure that we're actually able to demonstrate impact in our work.
Just one word to respond also to Terry. If you read the roadmaps of the 23 countries that have implemented the gap wasting, they are very well done, very detailed. So I think there we have really a good optimistic view that things can change.
Thank you. Let's take one or two questions from online.
Yeah, so this question is from Sophie Bruno. So it's a query about why there isn't objectives to focus only on the 15 priority countries over the next 3 years, where there are more needs that need to be considered outside of these 15 identified countries.
Who wants to?
I can start and Avi can continue. I would like to say a word because we are using high burden countries as a proxy for high problem countries, and that is not always the case. And I think something that the guidelines make it very clear is that context does matter. So I would make a distinction between high burden, high risk countries and high burden, lower risk countries, because our approaches need to be very different. What do I mean by that? We should not be guided by anthropometry only. That is, being severely wasted in a low mortality setting is very different from being severely wasted in a very high mortality setting. So high burden, high risk settings are those settings where we feel there is an urgency to provide a response. Whereas in settings where the risk of mortality is much lower, other interventions might be needed. So the question of context and understanding context is going to be of the essence. Those 15, we're using the word priority countries, and perhaps it is not the right word, but it is those 15 countries that together with WFP, we have identified as high burden, high risk countries. That is, countries and settings where children with severe wasting and wasting are at a much higher risk of death because of the epidemiology of infectious diseases and other risks. Those are the ones that we want to prioritize with the resources that we have. It also happens that in those settings, the ability of local governments and national governments to respond to that situation might be limited. So it's not that these are the only countries where we will work together, but those are countries where we feel that a timely quality response, comprehensive response that takes care of both prevention, early detection, and treatment is going to be of the essence. And those are the 15 countries where the Bureau of Humanitarian Assistance and other financial partners are supporting us. Anything else?
Well, just to add that I already looking at the kind of level of complexity of what it will take for us to operationalize these in a responsible way. We've got to have a manageable number in that. We can't underestimate the level of questioning, but this spirit of collaboration that we're fostering through this, for me, extends to way beyond those 15 countries, and that's what we want to be able to move forward together. In more than those 15 countries, but the 15 countries, as Victor said, is very firmly where we can see the biggest urgency for us to be able to support governments to get this right.
Thank you very much. Thanks. I think that's all the questions that we can take today. Yesterday, many of us were at the Global Food Security Summit organized by the FCDO and the government of Somalia, and it was very welcome to see the emphasis on food security and nutrition in the very first session, the opening session of the summit, which was on the new approaches to ending preventable death of children. So there was a lot of focus in the opening speech, as well as when the Prime Minister, as well as on the closing speech from the Secretary of State for Foreign Office, Lord Cameron mentioned. So a lot about nutrition yesterday. So I'm going to hand over to Chris Carter, who is Deputy Director of the Head of Human Development Department FCDO, to debrief us and to link the FCDO direction and how these guidelines are fitting into these priorities.
Great, thank you. Thanks, Jean-Michel. And what a wonderful panel and discussion we had. Now, the writer and poet Margaret Atwood said, "A word after a word after a word is power," which is good to know when you're doing closing remarks. But I think what I understand from that is that the words in these guidelines, the words of these panel members are powerful, but we need to drive them home. So here are my words of power from yesterday and from this morning. The first word has to be prevention. That's a major shift that we're seeing, and these guidelines are so welcome. A lot of work has gone into them. I also like, Annette, your challenge around, let's talk about how many cases we're preventing and shift the focus there. The second word of power is integration. And we heard that many times yesterday, and it was wonderful to hear DG Tedros talk about integration. That's integration of nutrition services into health systems and food systems. And we've been hearing again the importance of healthy diets and family foods, and looking at markets and so on. The guidelines are really clear here. Child wasting and malnutrition are not standalone issues, and they're not. Victor, you're right, they're not a donor issue, an external financing issue. They must be integrated into all the action that we do, not just on health, not just on agriculture. We've heard about education, we've heard about wider economic development work. Really important, social protection, exactly. And I really welcome the focus on child health and the child health in particular there. My next word is partnership. And fantastic to hear about UNICEF, JRFP, WHO working together on the ground, not just on panels. That's going to be a major difference. We've heard about USAID as well. We in FCDO, the UK government, are going to be part of that partnership. But we also know it's partner governments that must take centre stage. Let's never lose the focus on that. And we heard just now about civil society and how they have to fit into that partnership, not work outside of it, but work within it. And we welcome that, and we want that. My next word is actually two words. It's research and evidence. And we've heard quite a lot about that. Again, there are gaps still. Lynette highlighted the gaps in agriculture. We've heard about other gaps on prevention, and still we need to learn more about that. So let's not lose the focus on research and evidence, and I really welcome comments about data, which is going to underpin all of that. A linked word, I'm going to stop on the words in a moment. The linked word is innovation. And yesterday we talked quite a lot about innovation. We had quite a focus on Cigar and about the innovations that they come out, they brought out on agriculture. But we've heard about them in the health space, and we've heard about them, of course, in this space of malnutrition. But Victor, your comment around, we need to embrace them. We need to understand the innovations coming through. We need to share those lessons, and we need to start making sure that they are in everything that we do, that we don't take years and years and years to wake up to what we've discovered and these leap forwards. My final words, we can't get away from this. It has to be, the word has to be financing and operationalizing. Now, yesterday, the focus deliberately wasn't on financing, but that doesn't mean that a lot of this isn't about financing. And it was a fair challenge to FCDO, it's a fair challenge to all of us to really look at the financing. I really recognise what you said, Abigail, about predictability. Some of the shifts we need to make in the way that we finance are important and are going to underpin this. I do think on operationalising, the words and the guidelines do give us the power to take action. And it was great hearing from you, Francesco, about the GAP countries and now the work that's been going on with USAID and others on implementation. There's a really big job to do. Remember, we have to drive these words home. Next year is going to be another big year on nutrition, and we have to seize these opportunities, every single one of them. So there's the IFAD replenishment. We know that nutrition for growth at the end, but in between all of that, we've got the replenishments for GHI, that integration piece again. We've got IDA 21, and I was speaking about that on Friday, integration. Let's think about that partnership. We touched on UHC index. That's a massive opportunity on integration. And then Victor, you raised the action review panel, and I'm very excited about the Child Nutrition Fund and what that's going to achieve and how that's going to change the dynamic. So let's all seize these words. Let's get these guidelines, let's get them out there, and let's make sure we turn them into action. We can do this. Before I finish, just thanks a few people. So I've gone over a little bit, but I would like to thank, on the behalf of FCDO, ICANN, WHO, thank you, John Michelle, for chairing this morning. Thank Action Against Hunger UK for their support in organising the event, and Bain & Co for hosting. Thanks to all the speakers. What a fantastic group of people. Francesco, Victor, Abigail, Danielle, Lynette. Thank you very much. I'd like to thank Bernadette from Action Against Hunger UK and Rachel from Save the Children UK for moderating. You did that well. And finally, all of you for listening, for being here. I'm assuming you're listening because you want to get out there and get on with this and take action on this. So a big thank you for that. Thanks, everyone.
Thank you very much, Chris. So thanks a lot. And now we will have tea and coffee generously offered by Bain.
We'll bring it.
It's going to be here. Okay. Thank you very much again. Thanks to the 500 people who join us as well online. Yeah, impressive.
Nice to see you.
This meeting is nice. Where are you coming from? Looking forward.